Hey NCS podcast listeners, this is Fawaz Al-Mufti. Along with our regularly scheduled monthly podcast interviews, we will also begin releasing shorter podcast segments highlighting sentinel articles in the neurocritical care literature. We're calling them news flashes, and they're brought to you by our producer, Sarah Stern-Nezer. The neurocritical care world has been waiting for a 10A reversal agent since the factor 10A inhibitors apixaban and rivaroxaban were introduced to our armamentarium. Andexanet received both U.S. Orphan Drug and FDA Breakthrough Therapy designations and was approved under the FDA's accelerated approval pathway. The first news flash you'll hear from us today covers ANNEXA-4 trial results that was published in the New England Journal of Medicine 2016. The trial demonstrated the relative safety and hemostatic efficacy of Andexanet alfa in reversing the anticoagulant effect of factor 10A inhibitors. This study has since been followed by a larger cohort published by the ANNEXA-4 investigators in February 2019. I encourage you to read both papers yourself, but to summarize the details of the first trial, here's Sarah.
Hi, this is Sarah Stern-Nezer, and I'm bringing you a news flash, new science in neurocritical care, brought to you by the Neurocritical Care Society. Today I'm going to talk about Andexanet, a new reversal agent for factor 10A inhibitors. This is based on a paper published in the New England Journal of Medicine in 2016 by authors Connolly, Milling, Eikelboom et al. On behalf of the ANNEXA-4 investigators. So ANNEXA-4 is a multi-center single-group trial that is evaluating the use of Andexanet to reverse direct and indirect factor 10A inhibitors in patients with acute major bleeding. Acute major bleeding is defined by the authors as overt bleeding with hemodynamic compromise, intracranial bleeding, or a significant decrease in hemoglobin. Patients were excluded if they had an intracranial bleed and a GCS less than 7 or an ICH volume greater than 60. Patients were also excluded if their expected survival was less than 1 month, if they had had a recent thrombotic event, or if they had received a different reversal agent. Patients were then evaluated at regular intervals up to 30 days. The two primary outcomes were 1, % change in anti-factor 10A activity in serum, and 2, the rate of excellent and good hemostatic control. For our patients with intracranial bleeds, excellent hemostasis was defined as an up to 20% increase in hematoma volume from baseline, and good hemostasis as up to a 35% increase. So what did they find? In this interim report, the authors present 67 patients with a mean age of 77 years. Most patients were taking anticoagulation for atrial fibrillation, and a smaller percentage, about 22%, for venous thromboembolism. 42% of patients included had intracranial bleeds as their acute major bleed. In this ongoing single-arm study, ANNEXA-4 does demonstrate that Andexanet reverses factor 10A inhibitors effectively within 30 minutes of administration, with factor 10A levels down about 90% overall, with some variability depending on what anticoagulant the patients were taking. Good or excellent hemostasis was accomplished in 80% of patients with intracranial bleed. There are a couple of points that are important to note regarding the study, particularly in patients with intracranial bleeds. The first is the ICH volumes were very small in the study, with less than 10 cc's for intraparenchymal hemorrhage in 2/3 of patients and less than 10 millimeters in 70% of subdural hemorrhage patients. This is probably in part because patients scheduled for the OR within 12 hours of presentation were excluded, which in of itself represents an important subset of patients for whom further efficacy and safety data is needed. Second, the definition of good or excellent hemostatic efficacy allows for up to a 35% expansion in intracranial hematoma volumes over 12 hours. This degree of expansion could easily lead to a worsening outcome, despite being adjudicated as adequate hemostasis. And finally, in terms of safety, the study authors report that 18% of patients had a thromboembolic event during the 30-day follow-up. This initially seems a little concerning, but I think it's reassuring that only 4 events occurred within 3 days of receiving Andexanet, and none of the patients had resumed anticoagulation. As we know, after a major bleed, most patients will continue off of anticoagulation, and it's likely that this high rate of thromboembolic events relates to the underlying reason patients were placed on anticoagulation rather than the reversal agent itself. So that's it for now. Thank you so much for joining us. For more information, please visit our website where you can find the full text for this article, as well as a more detailed summary and commentary.